Hi everyone, welcome to Metier YouTube channel. I hope you're all fine and preparing well for upcoming NORCET as well as nursing competitive exams. After a long time, I am posting a video regarding our exams, and it's a very important topic today we are going to see. So today, before starting the session, we'll start with a small quote. Success doesn't come from what you do occasionally. It comes from what you do what? Consistency. Okay. So consistency is a very important thing. So regularly you study, definitely you will succeed. Okay. So many updates have been happened in our medical professional. So they have done a updation in the nursing stroke related guidelines, shock related guidelines, thyroid related guidelines, and hyperglycemia and hyperlipidemia. So many guidelines have been updated in 2026. So hereafter, we are going to see that updation regularly. Okay. So today, what updation we are going to see? So the 2026 guidelines on acute ischemic stroke. So regarding what updation have been done. So before that, 2018 and 19, they have given the guidelines for the ischemic stroke. Okay. So before seeing the guidelines and updation, we should know what is stroke and what are the types and how to identify it. Okay. So stroke, you all know that, otherwise called cerebrovascular accidents. So whenever there is a blood supply cut down to our brain, it's maybe due to the blockage or due to the bleeding or due to rupture of any vessels that leads to the reduced blood supply to the brain. So brain become ischemia, which leads to stroke. Okay. Its symptoms will be vary according to the which arteries are involved, which side of the brain is involved. The symptom will be different. But commonly, what are the symptoms we can see? Sudden weakness of our face, arm, or leg, difficulty in speaking, loss of balance, and severe headache. So these are the symptoms of commonly for stroke. But that stroke, different type of strokes are there, and the symptoms also will differ. Okay. So what are the main types of strokes in the brain? Ischemic stroke, hemorrhagic stroke, and one is called TIA, transient or ischemic attack. Okay, it's called a mini stroke. It's especially when the minute blood vessels are getting the blockage, we will get a TIA. Okay, so these are the three types of stroke. So whenever the patient is having the stroke, so how can we identify? So there is a mnemonic called BEFAST. Earlier it is called FAST. Now it is BEFAST. B for sudden loss of balance. Okay, sudden loss of balance will happen and sudden loss of coordination can happen. And E, that is sudden vision changes. Okay, the patient will complaining of blurring of vision suddenly. Okay, so that is E. And F for facial drooping. Okay, sudden dropping of one side of the face, that is F. And A for arms and legs, sudden weakness, the patient unable to elevate, unable to do the work in the one side, suddenly it's called arms, A. Okay, and S for speech, slurring of speech. Now, normally the person is speaking fluently, suddenly their speech will be disturbed. Okay, the slurring of speech will be there, and the T is final one. It is time to call an ambulance. Okay, so this is a spot, the sign of a stroke. It is called BEFAST. So now this is commonly everybody can do this assessment BEFAST. But when the patient is reached to the hospital do the assessment. So that is called stroke scale, NIH, National Important Health. They have given a stroke scale. So they will do the complete brief examination of the patient. So according to their symptoms and the signs and the assessment, they will give the score. So why the score is important is why this NIH scale, stroke scale is important means based on this only, whether this patient, that especially for the ischemic stroke we are talking about, this ischemic patient required this thrombolysis or not. So this is the main thing. So thrombolysis, whether this patient required or not, this is based on this NIH stroke scale. Okay. So many descriptions are there: level of consciousness, level of conscious questions, level of commands, best gaze, best visual, facial palsy, motor movement of right limb, left limb, right lower limb, left lower limb, ataxia, sensory, negligence. These are three. So many things are there. So according to that, neurologist, okay, or emergency residents who are in the emergency department, they will give the score So based on the score, whether what kind of stroke it is. Okay. So if the score is 0, no stroke. So there is no need of thrombolysis. Okay. And if it is 0 to 4, it's a minor stroke. And 5 to 15, moderate stroke. 16 to 20, moderate to severe. 21 to 42, severe stroke. So based on the severity of the stroke and the NIHS score, they will give the thrombolysis. Clear? Okay. So this is what we have followed till 2025. What updation they have made in the 2026 that we are going to see, that is very, very, very important. So first thing, you can see this scroller, IV thrombolytic, what they have followed till 2025, it is altiplase is a standard one. So till 2025, we have followed altiplase. But in 2026 protocol, so mainly they are focusing on tenecteplase rather than altiplase. Okay. So we can use both. So that is why they are given altiplase or tenecteplase. But the first choice will be tenecteplase because the improvement in the stroke patient is very good in the tenecteplase because of the studies they have shown that tenecteplase is best. Okay. And then in 2019, they have used only altiplase. Tenecteplase, where they have used in the 2019 protocol, only in the selected case only they have used the tenecteplase. But in 2026 protocol, strongly recommended that tenecteplase. Okay, 0.25 mg per kg body weight. So this is the dose. Okay. Earlier, what they have used 0.4 mg per kg. It's too much for the patient. There is a chance for bleeding and complications are there. So they have come to the conclusion that it is 0.25 mg per kg body weight. Okay. So that is the dose. Okay. So here in the 2019, they have used this 0.4 mg kg body weight. But in 2026, we are not following this 0.4 mg kg body weight. We are not using. The dose is reduced to 0.25 mg. So that is an update. And thrombolysis window. So when the patient is having a stroke, so up to 4.5 hours only they will give this thrombolysis. So that is 2019 protocol. But in 2026, that hour is expanded till 9 hours. Up to 9 hours also with the help of imaging based selection like advanced MRI, CT scan, everything they will see. So based on that, up to 9 hours also we can thrombolyze the patient so that patient can be saved from the stroke. So 4.5 hour is a older one, up to 9 hour is a newer one. Okay. And next one, NIHS stroke scale. So 2019, they have only focused on this NIHS scale. They have greater emphasis on the score only. But in 2026, they are not only see the NIHS score, treating according to the patient deficits. Okay, disabling deficits. In maybe the patient may get, if they are suspecting also, they can give the thrombolysis. Okay, not only based on the NIHS scale. Remember that. So that is also an updation. And mechanical thrombectomy in 2019 protocol, what they have done, only the selected larger vessel occlusion patient up to 24 hours, only for the larger vessels. We have smaller vessels and larger vessels in our brain. So in 2019 protocol, mechanical thrombectomy, mechanically they will remove the clots. So that is for the only larger vessel occlusion up to 24 hours was a older one. So what is the newer one? Expanded eligibility including some large core infarct also. Not only occlusion, for the infarction also they are doing this thrombectomy. Okay, mechanical thrombectomy, that is also an update. And basilar artery occlusion. So in 2019 older protocol, if the patient is having basilar artery occlusion, they won't do any mechanical thrombectomy. But in 2026, stronger recommendation for eligible patients. So they have the criteria. So according to that criteria for the basilar artery occlusion also, they will do the thrombectomy. Clear? Okay. And pediatric stroke. In 2000 older protocol, there is no proper guidelines for the pediatric stroke. So, but in 2026 also they have stronger recommendation, some recommendation added for the pediatric stroke also. Okay, clear? Yes. And mobile stroke unit, they have in the older protocol, they have it's just an emerging concept. They have planned only, but in 2026 they have dedicated recommended where these mobile stroke units are available in some of the countries. Okay. And then EMS transport, which unit, which area we have to shift the patient. Suddenly they are getting stroke in their hospital. Nearest stroke capable center was an older protocol, but in the 2020 protocol is wherever the thrombectomies can be done, that area we can shift the patient. Okay, that is also an updation. And then BP, that is very, very important for our NORCET exams. Uh, it's completely unchanged, less than 180 by 105. So the main target is after thrombolysis, we should not reduce the blood lesser than 180 to 105 because there is an change that cerebral perfusion may be changing. So it's not changed at all. Okay. Then glucose control, tighter the control often attempted. So don't try to hypoglycemic the patient. So try to maintain the glucose as much as possible to prevent the hypoglycemia. So these are the main updation have been happened in the 2026 stroke protocol. Remember, altiplase is replaced by tenecteplase. Tenecteplase dose 0.4 replaced to 0.25 mg. Okay, that thrombolysis window period is 4.5 hours to 9 hours. Okay, so these are the major changes according to our exam point of view. Okay, so you can see through these slides once again, and thank you all. I will meet you in the next session with another updation. So many updation I have explained you. Septic shock, hyperlipidemia, thyroid related updation have been happened. So we will post regarding this updation as soon as possible. Thank you all. Prepare well. All the best.